welcome back for part 4 of your series in medications and mental health. Today I'm just going to run through benzodiazepine use in anxiety, and we'll do some background, some of the action of the benzodiazepines, side effects, and some of the common types that you'll see used in practice. Oh, excuse me. So this group of widely prescribed medications was invented again by chance by Leo Sternbeck, a chemist in the USA in the 1950s. The drugs have been and are widely used for the treatment of anxiety and mental health, but they're also widely used across medicine. These medications are generally safe for single use and in a safe dose. However, they are at times widely abused, and they can interact with other medications or alcohol or illegal drugs. Some of the controversy around these drugs over the years is related to addiction and withdrawal, and we'll have a look at that just as I carry on the presentation here. So just thinking about the action of benzodiazepines, again they're targeting neurotransmitters in the brain, the synaptic gap. In this case, gamma-aminobutyric acid, or GABA, as it's more easily known. GABA is the brain's own anxiety reduction mechanism and neurotransmitter, so benzodiazepines bind to GABA and make it more effective. There's also some action in serotonin and norepinephrine in the brain, and this is important especially in the amygdala in the brain, as that's the area in the brain that scours the environment, sending messages about possible dangers around. So by increasing the effectiveness of GABA using benzodiazepines, there's an associated reduction in symptoms of anxiety. I'm sure that this slide will give you some idea of the type of benzodiazepines you've seen in practice. Some of them are used for sleep only, and some used for managing symptoms of anxiety. There's obviously issues across the age ranges here, and so doses and recommended daily doses are quite broad at times, and different medications are better for different groups of people. But I'm sure you've come across, in particular, chlorodiazepam, you know what I mean, that one, third one, diazepam, lorazepam, temazepam, and maybe others in practice as well. Important for you when you're seeing these being prescribed, just to have a think about the interactions, possible interactions with other medications, and also think about the possible side effects, which is what we're going to talk about just now. So the main side effects for benzodiazepines are psychomotor retardation, so in particular drowsiness, sedation, dizziness, and ataxia, so clumsiness or unusual gait. Those are ones to be very aware of. Different types of drugs, some have short half-lives and some have longer half-lives. Those with the longer half-life, like diazepam for instance, would cause more psychomotor retardation. That could be particularly important to you as a nurse if you're working with older people, as they may be more susceptible to falls, etc. So you have to be aware of these situations in practice. Withdrawal is an issue, or can be an issue, or as we call it, of course, discontinuation syndrome. Patients will ask you if there are withdrawal symptoms, and there are. Rebound symptoms like rebound insomnia or anxiety can be quite common, and a sudden withdrawal, sudden discontinuation of benzodiazepines. Also, like we've looked at some of the antidepressants, severe flu-like symptoms, so physical symptoms, aching muscles, sweating, etc. Psychological symptoms like irritability, nightmares, agitation, and some perceptual disturbance as well. So it's important that you as a nurse can be open and honest with your patients about these potential side effects of benzodiazepams if you've seen them being used. Diazepines, not diazepams. Important to, oh god, bear with me. Don't want to start again. Sorry about that. Important to just think about overdose, because it is an issue again with all psychiatric medications. So generally, a overdose with just benzodiazepines wouldn't necessarily be fatal, but unfortunately they're often taken in combination with other medications. So for single drug overdose, things like drowsiness, confusion, sleepiness, tiredness, poor coordination, slow reflexes might be noted. For more severe reactions or in combination with other drugs, drops in blood pressure, respiratory problems, loss of consciousness, and respiratory arrest. Oh my god. Could be a possibility, especially if the benzodiazepines are taken in conjunction with ethanol, alcohol, or opioids. So that's been a very brief run through of benzodiazepines, which I'm sure you have come into contact with in all services, addictions, adult mental health services, and older people, either for their sedative effects or for their effects on withdrawing from alcohol, or their effects on general anxiety disorders or panic disorders. So I hope that's been useful to you. See you in the next part.